Hi, my name is Dr. Ian Williamson, and I have the great privilege of serving as the Dean of the Paul Mirage School of Business here at the University of California, Irvine. Welcome to another episode of the Dean's Thought Leaders series. Today, we're going to talk about the future of health. And in particular, I'm interested in this idea of how technology, health, and maybe even business are all starting to coalesce. Now, this is a really important topic, never more important than it is today, and I could not think of a better individual to have this conversation with than our guest today, Dr. Anthony Chang. Now, why do I say I think he's the perfect individual for this conversation? Well, not only is he an MD, and he is a recognized MD and has been identified as one of the top doctors and one of the leading innovators in healthcare. In addition, he also has an MBA and has started firms and is engaged in the commercial side of health. In addition to that, he has a master's in public health and has thought about the broader impact of health on communities. And in addition to that, he has a master's in science in biomedical data science and has been known as referred to as Dr. AI, referring to artificial intelligence. His many accomplishments we don't have time to cover, but I do want to point out that he is the medical director and founder of the Medical Intelligence and Innovation Institute, which I think is a really renowned and very innovative entity. This organization is dedicated to the implementation of data science and artificial intelligence in medicine. So again, I think we have the perfect person to talk about the future of health. Anthony, thank you very much for joining us today. Really appreciate you taking the time.
Thank you, Ian, for having me.
So, I could start in a lot of different places, but let's start with this. How do you think technology is going to impact healthcare today and going forward?
Well, I think technology in general, including artificial intelligence, is still underleveraged in 2022, but I think as Amar's law that we all know so well indicates that 10 years from now, we'll be looking back and say, well, we weren't expecting enough of what technology can do, especially I think the realm of artificial intelligence will really be exponential in terms of the dividends within this decade.
And what are some of the dividends you think specifically artificial intelligence is going to play?
Well, we already know that it's able to interpret medical images with a high degree of accuracy, probably as good, if not better, than most human clinicians, even groups of subspecialists.
Wow.
So that's been already a delivered dividend. And now we're talking about real-time interpretation of medical images. So when we're getting our colonoscopies, rather than have the gastroenterologist guess whether or not he or she should biopsy for a specimen, now that procedure can be accompanied by artificial intelligence so that we will have a much better guess as to whether or not a biopsy should be taken. So that's just only the tip of the iceberg of the possibilities in terms of medical image interpretation. And then other areas that are being explored include decision-making process in clinical care. And as you know, patients are getting sicker, more complex, and require longer-term care than ever before. And this pandemic has really created a lot of issues longer term that we haven't even really explored yet.
Yeah.
So I think this generation's expected to live a shorter lifespan, believe it or not, than the previous generation, partly because of the pandemic and all the chronic care that was sort of had to be paused because of the pandemic. So we really have some catching up to do.
Right.
So I think one of the best ways is to leverage all we can from a technology side to alleviate the burden of the human clinicians in the process.
So as I was describing before, you have a unique set of skills, I think. How have you been able to bring together your medical capability, your business capability, your understanding of data and technology, your perspective around broader systems of health? How have you as a professional been able to bring that together, and how does that guide the way you think about the work that you're doing?
Well, it is an interesting perspective, and I think perhaps your students and your alumni can agree that when you add an MBA to your home profession, the dividend is actually not additive, it's actually geometric because you see things in a very different light. And I think I feel that way about business, health, public health, and data science, because I think the future of health is going to be very, very dependent on how we navigate the conundrum of healthcare data and how we monitor our patients and monitor people in general for health. So I'm very excited about an initiative here in Southern California called the HealthCellCount.ai initiative, which is going to hopefully tie all those dimensions together and be able to have businesses in the ecosystem that will deliver better health with leverage of data in healthcare, as well as the social determinants of health. And also, we have to have a very, very focused effort to reduce health inequities that are potentially going to be perpetuated with the use of artificial intelligence in healthcare.
So let's talk about health inequities. That's a very big topic of focus here at the University of California, Irvine. Not just in the medicine space, but in the business school. We have a Center for Healthcare Management and Policy. This is one of the key topics they're focusing on, and across a wide variety of departments. How do you see artificial intelligence or other related technologies either exacerbating or resolving that issue? What are some of the tensions there?
Well, I think as the progenitor of artificial intelligence, Alan Turing, said, we cannot rely on humans alone to deal with machines. So I'm always remembering the current era interpretation of what he said. Those are very wise words. He said those during the Second World War. I think it'll be very important for us to understand ourselves, because a lot of the biases are unintentional, but kind of carried over from practice. And I think one of the best things about artificial intelligence in healthcare is it forces the practitioners to really think about their own practice. And it's a kind of a mirror to your practice when you have artificial intelligence, which is a misnomer because it's really human-derived machine intelligence. So to teach the computer certain things and be able to set up the projects, you really do have to understand how you practice and whether or not you're unintentionally biasing your delivery of care. So I think it's going to be really incumbent on us to understand AI and how it could be applied to healthcare, but also use AI to minimize bias in healthcare by having algorithms set up so that you kind of have a check on your potential bias, be it population asymmetry or care delivery nuances that weren't appreciated before. So I think it's going to potentially initially exaggerate inequities, but I think in the longer term it will, I'm very confident that will help to reduce the inequities.
Got it. So where's your sense in terms of, I mean, you've created this institute, it has a really powerful mission. What is your sense about the state of the affairs in terms of where, in general, the sector is, the health sector is, in understanding and adopting? Close, not so close? And what are some of the big barriers you're seeing around that?
Well, I play the violin, as you know, Ian, so I can equate to musical periods. I think we're sort of, now other sectors in society are a little bit farther advanced.
Okay.
But I think in healthcare, I think I would say that we're in the medieval period, mainly because we still haven't had an opportunity to really disseminate the education of artificial intelligence for students and trainees at all levels, and even the senior practitioners need to learn. So I think it'll be another few years before that really kind of is promulgated within healthcare. But I think once that happens and people appreciate what it is and what it can do, as it's been said, you don't know what you don't know. So if you don't know that medical images can be more accurately predicted based on machine and deep learning, then you may not appreciate that as a resource. So it's a wonderful resource that has been delivered ahead of schedule, probably even a decade ahead of schedule.
Wow.
It's almost like it caught us off guard in healthcare about, gee, how do we use this resource? And I think more and more clinicians are getting educated. I'm the privileged chair of the American Board of AI Medicine, and we give monthly review courses. As a matter of fact, we're doing one on Friday to really get everyone a sort of a crash course on artificial intelligence and how it could be used in healthcare. So it's a very exciting time. And I think more and more clinicians will be also educated in this area. 11 years ago, when I went back to school, I was one of 2 clinicians in a program at Stanford of close to 100 master's and PhD students. So just a tiny minority of the students there. And I think, and there weren't many clinicians with current era artificial intelligence education. Now I think we perhaps have a few hundred finishing school in these areas. So it's getting to be a very exciting time when more and more people can converse about this. It's basically a new language.
Got it.
And we have to be perhaps just conversational and understanding the basic aspects of artificial intelligence and be able to justify its use and look at the dividends. Now, there are many, many ethical issues and regulatory issues and legal issues, and not to mention financial issues that will have to be solved this decade, but I'm very confident that we'll find our way.
So let's talk about a few of those issues. Let's start with the ethical one.
Okay.
And this is, I think, the technology oftentimes outpaces our understanding of all the intended and unintended consequences. And what do you see as some of the spaces of ethical deliberation that we as a community, more broadly, but also the sector of health needs to be spending time on thinking around now?
Well, that's a great question because it's we're still in sort of uncharted waters in terms of ethics of AI in healthcare. Now, there are lots of papers written on ethics in AI and ethics in healthcare. But when you combine all 3 domains, it gets really interesting. As a matter of fact, I'm with a group of authors working on a book of this topic because it's really new territory. But having said that, I think most of the time we're asking about the ethics of AI in healthcare in the sense that, in the context that we want to make sure that the decision doesn't get taken away from the practitioners and that the machine isn't going to deliver care autonomously. And that's actually a very legitimate concern, but that's not my major concern. My major concern is not using AI that's been proven to be mature and effective in time to justify the loss of life in cases that could have been, I think, salvaged with artificial intelligence. And I think we're already starting to see cases that were missed by human practitioners looking at radiological images that could have been picked up by artificial intelligence, and the patient suffered a negative consequence. And I think sort of sliding into the legal realm, I think that we will see cases in which the families will have a legitimate claim that artificial intelligence should have been used. So we have to talk about the ethics of not deploying AI just as much as we enjoy the discourse on using AI in healthcare.
So we move into the realm of you knew or you should have known. And do we have that skill set within the clinician's hands to understand that this is an expectation? It sounds like to some extent what you're discussing really has major implications for the way in which we will train future clinicians. Do you see these types of changes happening now in the medical programs in terms of bringing in these types of skill sets as part of the required curriculum?
I think too slowly. It's been over 100 years since we had the Flexner report. As you know, that was a treatise on medical education. And I think even medical school deans have agreed that every 100 years we need to make some changes. Because I actually made that statement at a keynote address to the medical school deans, and they were all laughing, so they weren't upset. So I assume that they agree. And I think we need to train the clinician of the future today. And I think that we're not adequately preparing the clinicians for tomorrow through the medical education that we have now. So I'm excited to be working on a medical school curriculum called MedEd 2030, which is embedding the current curriculum with elements such as artificial intelligence and transdisciplinary collaboration and entrepreneurship, all of the topics that you really find interesting. And I think we need to embed them rather than radically change the curriculum. I don't think any medical school dean would be up for a radical transformation of the curriculum, even if it's warranted. But I think perhaps embedding these elements into the current curriculum will be a very good start. And I'm very excited to be working with 3 schools right now to accomplish that in the next year or 2.
Got it. So you mentioned there's the ethical aspect of it. There's the other aspect of the financing or the delivery component, which is non-trivial. And that certainly brings to bear some of the business aspects of this, the commercial side of health. What are the types of issues you see there that we should be thinking about or having to overcome? Or, even you talked about what the opportunity is there for medical school deans. What's the opportunity there or the challenge for business school deans in this particular space? How should we be supporting this?
I think one way business school can support this whole effort for adoption of AI and related technologies to improve healthcare is to explore business models that can work in the existing healthcare system, which is always a challenge. And I think 1 or 2 companies recently have basically been able to get Medicare approval and for compensation by having that tool available. So it's been going fairly well. It's led to a relatively wide adoption of this tool. And I see that as a very, very important sort of precedent to other similar tools to be used. And I think the lunar landing moment for AI in healthcare is that we no longer make a big deal out of an AI tool or in healthcare that it's just going to be embedded into so many aspects of healthcare. It becomes a new brand of medicine in healthcare delivery, and that we don't make a big deal out of a tool that's being used with AI to just be similar to, search engines that we have now.
Yeah.
You don't say, well, your book recommendation from Amazon is based on machine learning. You just learn that those are books you might want to buy. So
Right.
I think I see that within a decade or so in healthcare that we're just not going to make a big deal out of an AI tool being utilized for healthcare. We're just going to say that's how we practice now.
I listen with great intent around this because certainly artificial intelligence is impacting all aspects of the business activity. And we've been having some conversations about, well, how does this change what we do? Do we need different types of skill sets, different types of academics, different types of curriculum? So I do see that I would imagine it'd be even more of a challenge in the health space where there's more regulatory constraints around this and accreditation bodies. But the journey must begin.
Yes.
It certainly must.
And I think the regulatory issues are not small, but I do have to give kudos to regulatory bodies, both here and internationally, for really starting to change their mindset about the traditional regulatory process of medical devices being utilized for artificial intelligence. As you know, artificial intelligence changes by the minute. It cannot be confined by regulatory process that we use for medical devices, which usually takes months to years for modification. So I do think that we're starting to come around to a faster regulatory process that's needed because the technology is exponentially improving. You can't have a linear trajectory for regulation and basically hold back the advance of these technologies being used for healthcare, which is always the North Star for us and using AI in healthcare.
So let's say you were starting today. You're entering into your medical program, fresh into the program, and you're looking for advice about being the future-proof doctor, if you like. What advice would you give yourself if you were starting today around the types of things that you'd be focusing on as a clinical professional, as a healthcare professional, what would be the things that you would want yourself or any of the students we might have here at the University of California, Irvine, to be thinking about as they focus on how they can contribute to health and well-being?
No, I think that's a brilliant question because we really don't know the future.
Yeah.
But I think all the signals for the future are pointing towards a true appreciation for emerging technologies as well as entrepreneurship for especially people going into the healthcare sector, because I think right now the conundrum in healthcare is inadequate delivery of good healthcare at a price that we can afford. So hopefully in the future we'll be able to solve this conundrum. And I have, as you know, I host a lot of interns every summer, and I think the current generation, if we can't get it done, we just need to get out of the way, because the next generation is full of great ideas about how to use technology to deliver better health and also at a price that we can afford.
Doctor, thank you very much for taking the time. Thank you for your service and just the tremendous service you've provided to the community here in Orange County, particularly the children here in Orange County. Thank you for your vision and in terms of being the willingness, the personal willingness for you to illustrate the combination of the various different skills, and also your willingness to lead the discussion, not just here in the U.S., but globally, around what is something that will shape all of our futures, how technology hopefully enhances the quality of life that we all have, and all the various things we'll have to overcome for that to happen.
I think this pandemic has really taught us how important it is for we humans to work closely together than ever before. And I am proud that about 53 centers of AI in healthcare now have come together and joined their efforts to improve healthcare, not just here in the U.S., but around the world. And I think perhaps the one message I'd like to leave everyone is think of ways of collaborating and not only stay with your institutional agenda, because I think together we will not only beat the virus, but deliver healthcare for the future.
It's a perfect message. Thank you very much.
Thanks, Ian.